Hello everyone, welcome back to our channel. I'm Dr. Mel from City Skin Clinic and it's great to see you again. If you've been keeping an eye on our channel and liking our content but haven't done so yet, please don't forget to subscribe to this channel. So today I'm going to talk about treatments for marionette lines, and this is something that we see quite a bit in clinic. It's more common in patients sort of in their mid-40s or even 40s upwards, and it's something that we see in both men and women, although albeit it's usually a little bit easier for some of our male patients who may have beards to kind of disguise it, but it's something that makes a huge difference in terms of making the lower face sharper, better defined, and just a little bit more youthful looking. When we talk about marionette lines, these can also be connected with jowling, a jowl appearance, and really the main cause of this is again volume loss and the shrinking of the fat pads in the face that causes the skin to hang a little bit lower, and also muscles of expression that pull down the mouth, and over time they deepen these folds and wrinkles. A lot of patients usually want to get rid of them because they usually describe just kind of looking grumpy all the time and just not liking having all these lines and folds down here. Good news is there are quite a few treatments that can help with them, and just the only thing that's important to figure out is what would be the best treatment for you and what your expectations are. As with always, we're a non-surgical aesthetic clinic, so I'm going to focus on the non-surgical options, and surgical options. There are quite a few videos all over the internet that can show you how to get improve these, including things like lower facelifts. So first of all, obviously with everything, the most important thing to do is stop ongoing reasons for sort of the face aging. So one of these is making sure that you have a good skincare routine, particularly incorporating something like retinol, which will help smooth lines and wrinkles and just refresh the skin itself, making sure that you're always wearing SPF, even in the winter, to stop sun damage, which is a major cause of skin aging. And then of course there are things that sort of you can do professionally. So when we see marionette lines, we try and get an idea of, like any wrinkle, we look at, is it there all the time, or is it there when someone just expresses themselves? Most commonly people are only bothered by these lines when they start to appear always. If it's just a matter of when someone is kind of expressing themselves, it may just be due to muscle overactivity and imbalance, but to be honest, I haven't really seen any indication that people are bothered by them other than when they're there. So usually our main approach is, firstly, when we look at it, we look at face volume all over the face. So is it just isolated? Let me give you a clue, it almost never is. Or is there also loss of volume in the mid-face and everything's looking further down? If, as is usually the case, it's a lot of face volume loss in mid-face and lower face, then the first thing to do is replace that volume loss, and hyaluronic acid dermal fillers are fantastic for that. I particularly like Juvederm Volume and Juvederm Volift, and they can be used to restore volume loss here, and then also we treat these. And remember, it's a bit like our treatment for nose to mouth lines. We don't just treat these lines directly on their own, we also look at the other kind of causes of sagging around the face and treat that, and that way you get a much more beautiful and natural looking result, rather than just treating the line and then having the rest of the face look droopy. So usually in volumizing around here, that means also there's less to do in this area, and usually you get a really good result with both of these. Some people also require if there is this volume loss and there's a lot of muscle activity down here, they may also require a tiny bit of Botox just to relax these muscles and keep them from pushing down further. It's not something we need to do a lot, but in some cases it is. Another thing that we quite like doing in here is usually if someone has these lines around here, so the marionette lines, usually also the corners of the mouth are going down, and normally a bit of filler around here just supports this and it gives a much more youthful look to the mouth. If the lips are starting to also lose volume and look undefined, then a tiny bit of lip filler to help improve the definition and the shape really pulls together the whole look. There are other treatments if the volume loss isn't that severe, but it's just starting and someone doesn't want, for one reason or another, to go with dermal fillers. Profilo is a fantastic way to improve the quality of the skin. It contains hyaluronic acid, which instead of filling, the highly concentrated hyaluronic acid aims to stimulate collagen and elastin production in the skin, and what that does is it causes skin to be bouncier, firmer, plumper, and a lot smoother. And with that will help smooth out any lines or crepiness to the skin. It can also be combined with dermal fillers if someone has a problem with crepiness of the skin, thin skin, and on top of that a lot of volume loss that's pulling the lower face down. Then you can do dermal fillers for the volume loss and then Profilo to improve the quality of the skin, and you're treating both ways. With regards to things like microneedling, that's another good treatment, again in mild cases where this is just an early beginning and there's not very much in the way of volume loss or none at all. And then microneedling can help stimulate collagen in a similar way to Profilo and help improve the skin. Profilo uses usually 2 doses about 4 to 6 weeks apart, and normally you should repeat the treatment every 6 to 8 months, whereas microneedling usually involves at least a course of 3 to 5 sessions about 4 to 6 weeks apart, and then after that you might want to maintain the treatment once or twice a year. All of these treatments are great, but never ever forget, in terms of at-home skincare, and I previously mentioned, making sure that retinol, unless you have any medical problems, retinol or tretinoin are staples in your nighttime routine, and vitamin C and a simple acid exfoliant are part of your regular skincare routine, and of course SPF is a complete must. So in terms of marionette lines, that's kind of our main approach in the clinic to treat them. And the take home, I guess, is that there are treatments. It just depends on what how extensive your lines are and what the underlying cause is. And don't forget, these treatments can be combined, so you shouldn't ever seek to remove one kind of area of wrinkle or line in isolation. It's better to soften the effect of something and improve the surrounding tissue. You get a much nicer effect than just focus on a single area and seek to completely smooth it, but ignore any volume loss or any wrinkles or anything like that elsewhere. In fact, the disparity will highlight the other areas. And that's why you should always have a personalized consultation and treatment plan. Anyway, I'm gonna leave it at that. Please let me know if you have any questions about marionette lines and how to treat them. If you've tried any of these treatments, I'd love to know what approach was used and what you thought of it. And if you like our channel, please don't forget to subscribe and give a thumbs up to this video. Until next time.